Thank you everyone for joining us. Sorry for that little glitch in time. Um, we are here today for part one of the Data-Driven Partnerships series. There are two in this series, Understanding the Military's Role in Substance Use Prevention Partnerships. I'm excited today because today we're focusing on the assessment piece of that partnership, and Dr. Beverly Triana Tremaine will be speaking to us and talking, and she has some great resources for us as we start to begin to foster those relationships. And so we're excited to have her today. We first have our acknowledgement, and the purpose of this slide is to give you our acknowledgement. This presentation was created for the Southwest Prevention Technology Center with the support from SAMHSA, the Substance Abuse and Mental Health Services Administration. This content is public domain, except for any copyrighted material, and can be reproduced freely with proper citation. The views expressed are those of the PTTC network and do not represent the official stance of SAMHSA or the Department of Health and Human Services. If you need more information on any part of this presentation, you can contact me, and I will put my email address in we're going to use I'll do that later. Okay, I'll put my email address in there. Okay, so we're ready to move on to the next slide, Bev. This is Dr. Beverly Triana Tremaine. You can probably also see her in her camera. Or you can call her Bev. She's pretty formal and casual that way as well. She is the president and owner of Public Health Consulting, LLC, and has been since 2006. Dr. Tremaine has over 30 years of experience in technical assistance and training, evaluation, research, and quality improvement processes. She recently published Evaluation Time, a practical guide for evaluation. She is a certified Lean Six Sigma Green and Yellow Belt. Dr. Tremaine received her doctorate from Texas Women's University in Community Health with a public health concentration. I am going to now turn the time over to Dr. Beverly Triana Tremaine, and we have a wonderful presentation for you all.
Okay, well, thank you, Wanda. I appreciate it. So I'm Bev, as Wanda said, and I'm delighted to be here to talk with you today about the military presence in your communities and assessing that relationship and looking at what you can do from a quantitative and qualitative aspect to strengthen that relationship. So our journey today, we're going to go over our learning objectives. We're going to talk about the military presence and effects in a community with the military in that, and what are the challenges and opportunities that exist when you have military installments in a community. Then I will introduce a mixed methods approach to building a stronger or establishing a relationship with the military personnel in your community. And then we'll have a closing, and then we'll have questions or anything that you want to share that you know about. One thing that you need to keep in mind is that you are all experts as well, and I want you to provide just as much information in the chat or unmute yourself and speak. If you have anything to add, a resource, a way of doing something that would augment the material I'm presenting here, that would be wonderful. Okay, we're very informal today. All right, let's move on. So our objectives real quickly. We want to identify the factors that influence the community health in areas with a military presence. We want to identify key data sources that inform and improve substance misuse prevention strategies in communities with military installations. And this is something I designed for you, a framework. It's called the Qualitative Partnership Readiness Framework. And what it does, it's an instrument that I used the triethnic model and designed some questions around what you can ask personnel from a military installation about prevention and what they do related to prevention. And there's 6 aspects, and there's questions related to those 6 aspects. So I have a toolkit for you that you can take it and use it and modify it if you need to take and start having those conversations with your military soon-to-be partners. Okay. So this is our part 1, military presence and effects. And in the chat, what I would like you to do is to describe the influence the military might have on a community. So if you could do that in the chat. So you have military installments in a community. What do you think might be the influence that that military has on that community? Okay, Raquel, security. Okay, very good. Army headquarters, wow. Respect, jobs, increase in commerce, definitely. Economic development, protection. Yeah, a stable, large employer. Very good, Michael. A sense of, oh yes, I like that. Sense of pride, honor, security. Okay. Impacts political conversations. Okay, very good. Okay, economy, diverse workforce driven by spouses. Yeah, we also need to recognize that the spouses, the partners, the children, the family, they serve as well, right? Okay. Yes, very good. Unique cultural aspect among them. Absolutely. Okay.
Well, I think we can go home now.
They know it all, don't they? Very good. Yeah, that's good, Tara. Can be a transient nature because they do tend to, they pull up and move on to a different assignment. Yeah. Employers willing to hire might influence the bar and the nightlife. Certainly. Economic growth. Okay, I like that. Very good. A lot, don't you think, Wanda? Wide variety of
Yes, I am
ideas
impressed. I'm
there.
excited about it.
Oh, very good. Youth challenges. And this goes back to that. Everyone in that family is serving, not just the person who has that assignment. And that will definitely relate to some of the slides I have later. So let's go ahead and go to the next slide. So what I just asked you was, what do you think are the influences of the military installation, the community, on the community they're living within? And what I did is create a fishbone. Have any of you heard of fishbones before? The Ishikawa diagram, I'm sure you have. And so I created this to give a sense of what are the categories of effects of the military installments on the community. And so I looked through the literature, and I have several resources that I pulled these from, and I have those in your toolkit that I will be giving you later. So you don't have to worry about where I got those. I have those for you. I have the citations. So I broke them up I got them all together and did a little mind map, and then broke them up into what I call social, economic, environmental, cultural, capacity, safety, population, and resources. And of course, these are not all wonderful. Some of them are challenging for communities. Many of them are wonderful to have the military influence in the community. But you see, some of the ones that you mentioned are in here. There could be a social tension. The children who come in and out of the school. The jobs, there could be more competition for jobs because you have military spouses who are needing jobs as well. And there are people who live there, not part of the military, who need those jobs as well. The different business types that maybe spring up around a military installation. You can have different thinking styles. Yes, consistent pay. Yeah, mental health under resources. Yes, the mental health resources that you might have in that community. The healthcare might be different. Different crime. There may be different ACEs, conflicts. You would have military police around, and the community dynamics as a whole might be different. Okay. All right. Now, what effects have you seen in your community because the military exists there? Can you give us an idea of what you have personally witnessed? I know I gave you on the fishbone the ones I saw in the literature. What have you seen in your community? Okay, someone's raised their hand.
So, I live in Lawton, Fort Sill, Oklahoma, and one of the
Yeah.
things that happened in our community is the presence of the base has artificially inflated childcare costs. So our childcare costs are way higher than the state average,
Okay.
and we believe it's because the military's down here and they have the consistent pay scales. The prevailing belief is that a lot of the facilities are thinking that everybody's making more than what they
Right.
really are.
Yeah.
And so we're paying, much more than the state average for childcare, which is impacting everybody, even the military, in a negative way.
Oh, absolutely it does. Yeah. Yeah. So everyone has their own view of reality, and they're thinking it's a stable job, it's higher income, then we can charge it. And then it affects every single person. And childcare is one of those things that it gets at the root of issues in a community. Yeah. Okay, there can be negative as well as positive responses depending on the area and the political climate. Most often, the response can additionally be mixed due to the resources that are available on base that takes away from the community. Okay, Leah, very good. Yeah. So they're positive, they're challenging, negative. People will see it. It could be a positive one person, it could be a negative for another. The same exact thing that happens. Okay. Anything else that you've seen? And these are wonderful responses that you have here. So the child care. Okay. Huge support here for our military. We have a military museum. Raquel, where are you located again? Okay, Stephanie, influx of economic support in the community. It also impacts housing costs. I would think the housing would take the same route that the child care may, because you do have that stable job. You have a stable job. You're much different than someone who is in and out of employment. Huma, Louisiana. Yes, I've been through Huma, Louisiana. Okay, very good. Okay, so let's move on here. So the challenge and opportunity of a community military partnership. Let's talk about that. So what are the things that are challenging with a military partnership, and what are things that are an opportunity for a military partnership? And first, I want to make sure that you know where to get your military installments. And if you're not familiar with this, let me share real quick. Richard will be placing in the chat. Okay, let me do that. All right, so when you go to that link, if you're not familiar where you can find all of the military installments, you click on that link and here they are. This is on Military OneSource, and I'll be going through Military OneSource a little bit more later. But here you can click on a particular state, for example, Texas. Here you have all of the military installments. You have New Mexico right here. You have Oklahoma. I know we have some people from California as well over here. Okay. Did you know that this existed? Are you familiar with Military OneSource at all? And where to find the installations? Okay, good. I'm glad that's a new, let me go back to my screen here. PowerPoint slideshow. Okay, so that's where you find those, and I'll be talking more about Military OneSource a little bit later. Now, let's check our lens. And this is necessary, I think, because you have military personnel, you have civilians, and it's very, very important that when you're developing a partnership, really with anybody, but here in the military, we need to be very careful about the assumptions that we make regarding military personnel. And the military, in the same way, needs to be familiar with assumptions they may make about civilians. And so here I've just prepared from the literature some of the assumptions or perceptions that you may have about the military and about civilians. So military's disciplined, civilians are independent, hierarchical, decentralized, command and control, consultation and dialogue, rigid, very rigid or ad hoc, formal, informal, boys with toys, non-guided organizations, rigid, children of the 60s, authoritarian, and flaky do-gooders. Okay, now what do you think is good about checking our assumptions before we start relationships? And this can even be in a personal situation. We need to look at our assumptions about other people. If we meet people who might belong to a different category, you know, we put people in categories than we are, how is it good to make sure you look at those assumptions and those lenses? Help prevent you from embarrassing yourself. Very good. Okay. All right. Yeah, unencumber assumptions that we realized we didn't have. Good. Michael? Okay. Are there any on here that you've experienced or that you've had the experience, or that maybe you're not on here that I did not have? Or you've had an experience with some of these where you've been not saying things like Happy Memorial Day is something that shouldn't be said, as well as not assuming anything about anyone in general. Build rapport with people based on their experience in the backgrounds. Yes, yes, definitely. Remind you that your experience is not everyone's experience. Absolutely. Yep. Yeah, so, you know, someone has had an experience with the military community and you think, well, I'm going to have that same experience. That's not necessarily true. Okay. Others you haven't thought about, any that you've experienced in your professional work. Okay, differences happen when working on teams. Okay, Rhonda, good. All right, well, I think you get what I'm saying here. We definitely need to check our assumptions, that we don't need to assume, you know, when we look at someone that they're going to be a certain way. Okay, now I'm going to get into what I designed for this presentation, is a mixed methods approach to a military community partnership. Okay, and the mixed methods approach, how many of you are familiar with mixed methods? I bet there's a few here who are familiar with that. I like that last Civilians not knowing the military culture. Absolutely. Yeah. Okay. Yeah, we'll be sharing in part 2 the other military units and have them listed on the website. Understanding that everything is a federal process, so timelines are very important for feasibility. Timelines are very, very important. Yeah, good, Bethany. Okay. All right. So how many of you are familiar with mixed methods? When I say mixed methods approach, how many of you have come across that term before? Okay, good, Leah. Okay. Good, very good. Absolutely, good. Okay, so what I've designed here is a mixed methods approach to being able to identify what exists as far as military data, and then how to interview or have a conversation with military personnel that you decide you need to speak with. And so those together, if we will look at some data sources for quantitative data sources for military, and then we will also look at a way to collect qualitative data for the military personnel and asking them questions. When we combine that data, compare it, relate it, integrate it, we interpret it and use it, that's where we get our mixed methods approaches. It's integrated there. Okay. And as you know, looks like a lot of people are familiar with that. There may be some that are not. So let's just very quickly go over that. Quantitative and qualitative data. Quantitative approaches are very quantitative. Qualitative are very descriptive, interpretive, very language-based. You're asking how many there are. And then in qualitative approaches, you are looking for reason or context. But really, in the end, it's all data. Okay. And one thing I want to show you here is that on the left, if you look at, this is quantitative data, and I'm going over this just to make sure everybody's on the same page here. You have your age-adjusted suicide rate for males and female veterans. This is actually quantitative data. However, if I were wanting to know what it's like for women to serve in the military, and what are the challenges and the opportunities and good things that occur because of their service, and where they see that they could use more support, I might want to interview female personnel and ask them specific questions in focus groups, on surveys, interviews about what that is like. And so your wording, your text here, that would be the data that you would get. So if you're concerned about, a rising suicide rate of female veterans or females in the military, you may do a study that would help complement that data to tell you maybe where are some root causes there. Okay, this is some quantitative data on the left. If you look at the Oklahoma on the left, and Richard's going to place in the chat, he's going to place 5 different PDF documents. Okay, and this one is, I'm just showing Oklahoma here. And these are the suicide data for Oklahoma, and he's going to place all of them in here for every state in the region. Now, if you want it for another state, that link is in your toolkit. And you'll be able to find that in there on the page where it is the U.S. Department of Veterans Affairs. So you will have access to this, but he's only placing in there the sources for the states in our region. Okay, so here you're looking at Oklahoma veteran suicide data sheet, quantitative data. On the right is the 2024 focus group that looked at females in the military and what their experiences were. Okay. Okay, now next is the demonstration of the quantitative data sources and variables. Now, I think some of you had put on there that you were Jennifer, thank you for telling us that. The first and the third are, yeah, we need Oklahoma in there in the chat. So thank you, Jennifer. Now I will go to the Community Resource Finder, and let me share that here. Okay, let me share, new share. Okay, here we are. Sorry about that. This is the Community Resource Finder. How many of you are not familiar with this at all? If you could put in the chat. Okay. This is a wonderful, wonderful resource. So if you are starting out your partner, you're wanting to really connect with the military community, I would certainly go here. You'll need to go, and I have all of this in your toolkit, all the step-by-step instructions to get an account. You need to sign up for an account, and then they send you a link to click on, and you can set your password and everything. But this is called the Community Resource Finder. This is a small, I wouldn't say it's small, but it's a part of Military OneSource. So when you go here, you can look for any resource in any state. So if you click on Advanced Search, and then you see topics over here, you can select any of the topics. Let's see. Don't know why they're not coming down. Let me see here. Advanced search. Okay, let me make sure I am logged in.
It's possible the page timed out on you.
Oh, it's true. That is true. Okay, let me do this.
It should have managed the stress of the website number.
I know.
It's a webinar.
Yeah, I think it timed out on me. I had it open and everything. So access the resource finder. Okay, hold on just a second. And certainly feel free to go to it on your own browser, and then you can start doing that. Okay, access the finder here. There we go. Okay, so back here. So you go to, and Richard has placed in the chat the Military OneSource where you would go to get this account. So you can put any of these topics in here that you want. You can go over here to categories and put any of these categories. I'm not quite familiar with why there's a difference between topics and categories, but what I've done is, for example, if I'm in, let's say, Arkansas, you can click on Arkansas and you can select search. And then you scroll down, it will give you hundreds and hundreds and hundreds of resources for military communities by category. And the great thing about this is you can export it into your own CSV file right up here, or an Excel file. You can open that file, and then what you could do is start building a community or state asset library by resource. Yeah, and I'm giving you all of these tools in the toolkit that I give you. So this is what I downloaded and exported. So then you could start making this for your own state by the resource, and it gives you the program, the location, program description, and it gives you contacts if they're available, their websites, the phone number, the email, if they have any fees, the population they serve. And this is what's really useful, I think, is it will give you the county, or whether it's statewide, or, like Northwest and Central Arkansas, it will give you that type of thing. Okay, what do you think about this? Have you seen this before? Do you have a resource file started based on military communities, or, you know, and really this could be helpful for military communities, but it could also be helpful for any other communities that you want to assist. So, you know, it's not, I think you could broaden this and use it for your entire agencies. So any questions about this tool? Great, wonderful. Oh, yes, as a counselor, it would be awesome for you to have. Yes, okay. I'm not sure how often it's updated, but I do know that each service in here is vetted by the military, and they don't put it in here unless they, you know, they've done their due diligence. And I'm sure we could find it on there on that page how often they update that. So. Okay, so that is the military OneSource. Again, you can go to any other state if you wish, or you could certainly query by topics or categories. Okay? All right, so the next one I want to show you. Has anyone, I know you know about Syracuse University, have you ever heard of the VStart dashboards? And this is an effort by the Daniello Institute for Veteran and Military Families. They do a lot of work at Syracuse University, making sure that there is proper data on military families, on communities, and on veterans. And this is one of the dashboards that I wanted to show you. The great thing about this, it's called VStart. And I can't remember right off the top of my head what that stands for, but it is on this website. Oh, here we go, right here. Veteran Strategic Analysis and Research Tool. Okay, and what you can do, here's the county comparison dashboard. All right, and Richard placed in the chat the link for you to get here. Okay, I also placed in the toolkit that I'm going to give you later some more data sources that you are able to look at. We're just going to demonstrate this one. So you can select a state here. So let's say, for example, we select New Mexico. Okay. All right. We look at New Mexico there. Don't know why it didn't change. There we go. Okay, select New Mexico there, and it will give you, and you can select a certain state if you, or excuse me, county. You could still go over here and select New Mexico here, and then select another county. I'm just selecting random counties here. And it will give you the veteran proportion. It will tell you where the majority of the veterans exist in that state by county. It will give you the unemployment rate, the veteran population, the socioeconomic status of those veterans. Okay, you keep scrolling down, and this will give you the state unemployment by age dashboard for the veterans. Okay, you keep going down, and this will give you a state report. So you could click on here, and you could click, for example, Louisiana, and this will give you 7 different data sources on an infographic related to the veterans in your state. Okay. And here it continues to do the county unemployment, and it gives you a nice, I think this was done in OpenStreetMap, but it gives you a nice county map. And you can drill down by different county sizes, different states, different age ranges. So this is just a different way for you to, from that mixed methods approach, look at the quantitative data here. Okay. Also, they do this down here. Okay. Looking at the veteran demography, giving a map of it, giving the service by age. They give you the race and ethnicities and the different education levels. Okay, and that is, and there are some other resources on their website if you just go to that main web up at the very top, they have all kinds of policy engagement related to the military, data insights and tools. We just looked at other publications and evaluations and analytics. So you can search through that on your own time. All right. Okay, what about this? Did you learn anything about that? Deep dive. Okay. All right. All right. So those are the, okay. So this one, this is additional quantitative data sources from the South-Southwest PTTC. And this, I did this, was this the summer one that I think we re-recorded it this summer?
It says there at the bottom, it was in May.
Oh, was it May? Okay. So we did it in May, and Richard is going to put in the chat. What I did is I did a deep dive. I'll use Jerry's wording there. I did a deep dive into, I think, 3 or 4 different data sources, like the Census Bureau, and then the U.S. Veterans Administration. They have a website where you can get on and look at different data as well. And what I did was I recorded it, Wanda and I recorded it, and I went through all of those data sources and showed you how to use them. And we called it Swimming Upstream with Data, Military, Individuals, and Families. And so I would encourage you, this is also in your toolkit. This link, all of these links are in your toolkit. So if you can't get them out of the chat, don't worry about it. They are in that toolkit.
So Bev, a couple of notes that I made about this slide is that so the U.S. Census Bureau, if you're looking for demographics of the military in your area, the U.S. Census Bureau is the tool that Bev showed us in that video for that. And then the Department of Veterans Affairs shows us the suicide data for each of the states and communities. So those are some unique resources to what Bev is showing you today. Again, they come with a deep dive, and Bev has also provided handouts, so step-by-step instructions on how to pull that data for your community.
Oh, yeah, we did do that, didn't we, Wanda? I wrote basically every single step that I took when I went to the U.S. Census Bureau, and you can get many, many metrics on the Census Bureau related to veterans and military. And so a lot of it is, going on the U.S. Census Bureau, like, where do you go? What do you do? Well, Wanda and I created this handout that shows you step by step what you click and what you do with it. So why is this important? I'm showing you all this quantitative data. It's important because when you are going to try to develop a new partnership, it's really important that you understand your community and how you can describe them, right? So get a good epidemiological, I call it, understanding of the military community in your county and the language that could be used and, how they refer to things, and read reports. I've put several reports in that toolkit for you. So get your head wrapped around how you would describe the military individuals. Yeah, we're looking at group data, but it's important to understand what individuals are going through. Okay? All right. So is this helpful? Is that helpful to have a tutorial on the Census Bureau to be able to use that for data? And Wanda, we did 4 different communities. I believe we did rural, we did the LGBTQ, and there's another one and I can't remember it right.
We did the 3, and the 4th video is just an overview of all of them.
Oh, right. That's right. Okay.
Yeah.
So yeah, look on that. And if you haven't, yeah, always benefit from hand holding. I do as well, Jerry. Thank you. Okay. Well, thank you. Good. This is awesome. I want to provide things that are helpful to you. Okay. So that is an extra resource for you. So now what I want to do is introduce you to the toolkit I've been talking about all this time. And Richard has placed in the chat the toolkit. Okay. So if you want to open that up, let me get that. It's right here. Go to the first page. So feel free to follow along on your own copy, but you should have there. Oh, thank you, Candace. I work with homeless veterans. I have been a homeless veteran, and it correlates with what I'm doing in school. Thank you. Oh, that brings me so much joy, Candace. I am in awe of you for sharing that and for being someone to a resource for those individuals. Everybody needs help from time to time, and we want people to succeed. So awesome. Okay, is it good now, Wanda? Can you see it really well?
Yes, much bigger, much better.
Okay, wonderful. Okay, well, this is the toolkit that I have been talking about. And so what this does, this is a companion to the quantitative data that I just showed you. Now, you could spend an entire year in quantitative data. You know that. You guys are smart. You know that you could do that. What I don't think that we do enough of, and feel free to disagree or agree, is I don't think that we qualitatively analyze communities as much. And there used to be, I'm old, so way back 30, 40 years ago, there was a big, controversy about, well, quantitative is better. No, qualitative is better. Qualitative is not quantitative. Well, of course it's not. Quantitative serves a role, but qualitative data helps you get your head around what someone is experiencing in their life. And it allows them to share their lived experience. So I am a huge mixed methods approach person, simply because we are talking about human beings here. And unless we allow them to speak and share and become part of the research team, we're really not going to know through the quantitative data what they're experiencing and possible solutions. We want people to play a role in finding the solution that can help with those challenges that they face. Okay? This is not just about doing research to do research and be a good researcher and get publications and yada, yada, yada. That's not what it's about. Okay? So that's my pitch for mixed methods. So what I'm proposing to you is that this toolkit, it tells you about the quantitative data. So this is just a little introductory thing. And then if you go down here, now remember when I told you that in the toolkit, I would share how to do the military one source and the B-Start. Here are those directions right here, okay? How to get an account, how to access the military one source, how to download all of the stuff there, okay? So those are your things right there. So I would, get a folder on your computer, call it the Mixed Methods Approach to Military Partnerships, and start putting your data in that folder that is quantitative, and then, you can move on to the qualitative. And there are more in your toolkit here. Okay, so here's the V-Start that I've already showed you. We went into a deep dive there. Now, what does it mean to qualitatively research? Okay. What it means is to ask people certain questions and probe so that they are able to tell you what it is like to live with, say, depression or PTSD, or live as someone who is unhoused, or have challenges in the military, in any kind of challenge. And so what I've done is I've placed the interview questions around the tri-ethnic model, okay? And so if you keep going down here, and right here, let me show you this right here. This right here is the tri-ethnic center model for the readiness assessment, okay? That's where I got that model to do this instrument for you, okay? And many of you are probably familiar with the tri-ethnic center model, okay? Now, the model that I provided for you here, and I'll show you the data collection instrument in a second, it's based on 6 different elements. So if we're looking at you establishing a partnership with your military community, you're going to, you may not right now, but you're probably going to want to touch base, try to make contact with individuals on that military installation who you can ask, what does prevention look like in the military? How does, what does the military think that needs to be done about substance misuse, mental health, those types of things? And what do they think of partnerships, okay? And also, do they have any information, tools, strategies that could be useful to you? And so the questions are centered around what efforts exist at the military installation related to prevention. Do military, does everyone in the military installation know about those efforts? Does leadership, are they supportive of prevention in the military? And are they supportive not only in the military, it's not it is a microcosm, and then it's not. They do exist out in the larger community. And therein lies the challenge. What is the climate related to suicide and preventing it in the military or mental health disorders? And what knowledge does the military contacts that you make, what do they know about suicide, mental health disorders? Are they familiar with ACEs? Are they familiar with the resources I've showed you today? These are things that you could bring to them, okay? And then what resources do they have that possibly could support those efforts that you have? All right, here. Oh, wonderful. Thank you, Colleen. Okay, so she's placed a link and it has a bunch of trainings to educate people on military culture. Oh, that's wonderful. And do you say psycharmor.org? Okay. Okay, excellent, Raquel. We've got a testimonial there. So I would definitely take that, place that in your toolkit, and go there. And if they offer trainings, that is wonderful, especially on the culture. If we can understand someone else's culture, that's 90% of it, because we can be in that space and be comfortable and be accepting. So the toolkit, the scoring scale for the questions is based on a score of 0 to 4, okay? So you have the elements up here, and you have a series of questions that I'll show you in just a second. And then you have, for each of the elements will be scored from 0 to 4, meaning there's no existence of that, or there's minimal existence. There's moderate existence, high existence, or institutionalized existence, okay? And of course, we want all 4s. You may not get that, but we want that. That means that, for example, everyone, if we go back up to our elements, that everyone has a high sophisticated level of what suicide is, the stages to go that one might go through, adverse childhood experiences. They have a wealth of knowledge related to suicide and mental health disorders, substance misuse. Okay. Now, those are the elements, and that is the scoring. Here is our steps that you can use. This walks you through exactly what to do. And the 4 major steps are contact, collect, interpret, and use. So you're going to make contact with your partners. You're going to collect this data or find it and gather it. You're going to interpret that information, and you're going to use it. Okay. Here's where you find the military installations. And I showed you that earlier. So this is just a step-by-step process for how you're going to set up the study. Okay. All right. See all the different steps here? Okay. Now here are the questions. And you can see that I've separated these by A, B, knowledge of the effort. So let's just look at this one. Using a scale from 1 to 10, how much of a concern is prevention of substance misuse and mental health disorders in the military? And you're talking specifically at the military installation that you're talking with. And then describe what efforts they have available to address that. What formal and informal policies or practices and laws related to prevention are in place in your community, in that military community. Okay, and how do they view them? And then what you will do is write or type all of your here. You will type all of those out, and then you will give it a score from 0 to 4. 0 meaning there is nothing that is existing, or 4. Okay, and here we have some, many of the large installations have a department that is focused on prevention. Yeah, and you're going to talk about that more in step 2 or part 2. Is that right, Wanda?
Yes, Bev. So be sure to attend and register for part 2. I'll put the link in.
Yeah.
In a few minutes.
Okay. And yes, they're specifically focused on suicide, sexual trauma. Reach out to them. Definitely make contact with them. All military installation organizations have a drug demand reduction mission. Yep. Yeah. And so many of these things are already in place. You're just trying to get a sense of what that looks like to the person you're interviewing. Then you just go through. Here are the different questions. You can change this however you wish. And here are the different elements. And then at the very end, you would go down through here and give a total score. You can use this however you wish to use it. Okay. Now here are all the references I've showed you right here. And I've done some of these throughout the presentation. And those are the references. Here are the resources. Some really good resources here. This right here, if you're not familiar with this one, definitely go there before you do your interviews. This is a whole data appendix on suicide rates by state. Okay. All right. Let me go back to my PowerPoint here. Okay. All right. So was that helpful, the toolkit? Jerry, are you talking about the triethnic survey includes how to?
Yes, I'll dive in here. On the triethnic survey, at the end of the document, they also show how, in the case the original one was 0 to 9, it does offer some steps and how you want to move from step 1 to 4 to 5 to 6. So I'm wondering there may be a similarity to when you did the 0 to 4 in terms of what steps one might use to move up the scale.
Yeah, absolutely, Jerry. So what I want to say to follow up with what Jerry said is I would certainly go to that triethnic, the original manual that they give, and that is a wealth of information in the back. And yes, it was from 0 to 9. And what's beautiful about that is to move your level of readiness from one to the next. They give excellent strategies, and I think that's what you're talking about, Jerry, for how to move the needle on that. So
That's correct.
yeah, awesome. Thank you for giving that. Okay, so here is a poll. I'm going to test you here. What 2 items are not included in the major steps to conducting the qualitative data partnership framework? And so Richard has brought up a poll here. And if you could answer that question.
So remember, there were 4 of them. Just to give
And
you.
no one will know how you voted.
Right. This is anonymous. So there are 2 that were not part of those 4 major steps. They all make sense. This is one of those certification test questions.
Yeah. Okay. Well, they've given it their best effort. Yeah.
Yes.
So all of them definitely are good to do, but you want to contact, those are the major ones, collect, interpret, and use. So interview and use. So that's our poll question there. So, okay. Thank you. Okay. I think Richard will take that off now. Okay. Now, this is, to me, a really good overview of why we're doing this work. And what I would like you to do in the chat throughout this, when I'm not going to read this whole thing to you, but I think you can get a sense of what it's saying here and why we're doing the work is, this is a major life transition, going into the military, staying in the military, deciding to stay in the military or leave, or making that your life. That can affect not only you, your people in your family, and everyone else as well. So these are things, challenges and opportunities that we do need to consider. On the left, you can see here, very mentally and physically demanding work. And so I was going to say, if you could put in the chat why you're doing this work, why you are doing the work, okay? Why you want to help military communities. Why is that important for you to do that, okay? The geographic assignments, being here, being there, getting used to everybody again. Deployments, mobilization, diversity and inclusion issues. Now, these are the challenges and the opportunities. Here, we hope that resources are available to those individuals. And you have external resources, you have family, and you have individual. So if we could look this like very external with the family and then individual, kind of these microcosms of where people exist. And, I think it's helpful to have this language when you're trying to do interventions that will help the military communities. On the right, you have here family well-being and readiness outcomes. These are more enhancing up at the very top. Psychosocial, spiritual health, good leadership, parenting, communication. Of course, they want greater retention. What is the formula for that greater retention? Improved family functioning, deployability, improved job performance. And then down here on the bottom are your maladaptive outcomes. So things that could occur, in that military service person. Relationship management, family and flexibility. These are the things that could make or break that person's experience and affect their life. Okay, so definitely currently work with community county focused on veteran family needs. Very good. My entire family for generations, including my son, have lost their lives, and I hold those who have served and sacrificed for us all close to my heart and consider it an honor to support them. Oh, that's beautiful, Leah. Wonderful. Thank you, Jerry, for sharing that. Okay, so what would you do in the next, say, 30 days? What would you like to keep doing? What would you like to improve? What would you like to start doing or stop doing related to serving military communities? What did you learn today that possibly you could put into that KISS equation there? What do you want to keep? What do you want to improve, start doing, or stop doing? Can you put that in the chat? Keep building military connections. Very good. Okay. Any others? Yeah, you understand it firsthand, don't you, Rhonda? Yeah. Breaking down barriers to communication. Start looking for collaboration. Keep reaching out to chaplains, improving language and messaging. Very, very important. Hopefully some of these data sources can help you recruit others, help homeless veterans connect with their families. The resources you graciously provided, yes, what they offer and what more I can access. Okay, keep finding new data sources to be more considerate or culturally proficient. Remember to go to the Psych Armor. That's a wonderful resource, it sounds like, to go there and start your resource file with that Military OneSource Community Resource Finder. Go ahead and start that and keep an Excel spreadsheet. Okay, and remember, data are everywhere. Qualitative data is just important, just as important. Okay. Yep. Stop nothing. Good. Yeah. Figure out how prevention can partner with military. And I don't want you to think that, you know, the toolkit, you're going in and the military has absolutely nothing started. That is 100% not true. I gave you that so that you would have something as a frame to go in and start having a conversation. And then that conversation will take on a life of its own. And you probably won't need all those questions. But it's something to just have to go into the conversation if you're new to that person. Does that make sense, what I just said? Okay, you're going to, most of it is obviously finding out what they know, what they do, and linking that to what you're already doing. Okay. Oh yes, link up with your state governor's challenge, a great opportunity for service members, veterans, and family member services. Your local National Guard is also a great starting point and will have prevention-focused missions. Yeah, and I hear part 2 is going to be wonderful. Lots of resources there, and they will definitely be talking more about the National Guard. So, all right. Now, I want to end with a very special person. So this is my son. This is First Lieutenant Hayden Quinn Tremaine, and he is serving right now in South Korea. He's in the Chemical, Biological, Radiological, Nuclear Unit, or called the CBURN Unit. Many of you may have already heard about that. And the reason that I'm ending with a story about Hayden is that I think it's very important that, you know, he grew up wanting to be in the military, and readiness is so important. I think sometimes some issues the readiness factor, they need to look at that more too before they go into the military. And you all know that. He wanted to be in the military for a long, long time. And so when he was 15, he's about 22 right now. I said, well, if you want to be in the military, then you need to prepare yourself in the next 4 or 5 years for what that's like. And so I contacted the local fire department. It's a volunteer fire department down the road. And I asked the captain, I said, would you be able to have an intern, someone my son could mentor and tag along and serve, just like, he couldn't do certain things. But he got up in the middle of the night. He went for 4 years, no pay, and gave about 10 to 20 hours a week to this volunteer fire department. And he got to see things of what it might be like to serve in that way. I really wanted him to understand the service aspect of it. And the great thing about Hayden is that he ended up through the years teaching me about military more than I think if I would have read 10 books on the military. And one of the things he taught me is that when you serve in the military, that's one aspect of your being. And one of the things that he was very careful to, he did not want everything that I gave him. And I was at fault for this. I tried giving him stuff that was all camouflage or military related. And he said, not everything needs to be that. That's not what I am only. And so one of the things he taught me was that people are more than what they do for a job or the military. And we need to, especially with mental health issues and substance misuse, we need to realize that there are other parts to them and celebrate those other parts. Okay, and he's in the Army. He's coming home in 10 days, and I'm so excited. So I wanted to share that with you, but I think one of the biggest lessons from this, from having Hayden as a son, is that you need to look at other parts of people and celebrate all of them. Okay, Wanda, I'll turn it over to you.
All right. Thank you, Bev, so much for that presentation. We have a lot to take in and go back and research. And I want to bring your attention to, Raquel has posted in the chat box, the American Foundation for Suicide Prevention has chapters in all states, and they're working on specific trainings for military suicide prevention focused on service members, veterans, and their families. So look for that in late 2025. So you heard it here first. This is part 2 that we have been talking about throughout the presentation. Amy Thomas, you guys might, Specialist Master Sergeant Amy Thomas, I think, is that how you say that? She will be talking to us next week on Thursday, around the same time, 12 to 1 Central Time, 1 to 2 Eastern Time, 11 to noon Mountain Time, and so on and so forth. So we'll continue to talk more specifically about those strategies for building effective collaborations, about some of the culture, about all the different opportunities that are out there, some of the things that you all have mentioned. And thank you for being such an active group and sharing resources. So we really appreciate that. If you leave here with nothing else, you got a lot of resources to dig into later on. We know that you've received a lot of information by a fire hose, and I had a question earlier. Will you receive the slides? You'll receive everything. So we recorded this today. You'll receive the handout and the slide deck, and you'll get that by email in about a week. And then you will also get that. It will also be available on our website. Anything else? Yeah, so we have a whole bunch. That's one great thing that Bev is so good at is references and resources. And so we have a whole bunch of those. I think we've got 3 or 4 slides available. So more things for you too. So for those of you who said, start looking into the resources, you got your hands full. It's just a little something you can do during your vacation for the holidays, okay? So what questions do you have? Does anyone have questions? We've covered a lot, and I know it takes a lot to absorb, but maybe you just have some basic questions.
Yeah, I like the resources they gave, Wanda. Those are. I'm going to go to the Psych Armor and look at that. That's some good trainings.
Yeah, me too. Take a look at that. I'm looking through the presentation. You all did a great job on the effects of military in the community.
Uh-huh.
Okay, well, I'm not hearing any questions. If you have
Very good. Oh, Wanda, they had they have a training called 15 Things a Veteran Wants You to Know. Oh, that sounds really good.
okay, that is neat. Okay, so another one. Put
Yep.
that on your list.
Yep.
Okay, so please don't leave until you have a chance to complete the evaluation. Here is Richard's putting that link in the chat, and also you can use that QR code on the screen. Take your camera from your phone and take a picture of it. It's super easy to complete it on your phone. So let us know what was helpful to you and where we could improve. Especially we have part 2 next week. We're starting out a new funding cycle. And so we want to know how we can continue to improve our training throughout the year. Today I was taking over for Derek Newby, who is on vacation. And so if you have any complaints, email Derek Newby at this email address. I'm just kidding. If you have any further questions, it's dlnewby@ou.edu. And again, we will be sending all the information out in about a week. We're going to be trying to get that out before our vacation for our holiday.
Yeah.